This is a PNF contract relax technique to the trapezius. And what we'll be doing here is showing a bilateral and a unilateral version. So the patient is in the supine position, and I've just inclined the head of the table to make the patient nice and comfortable. I'm supporting their head, and they are relaxed before we start the technique. Now, what I want to do is find the first initial stretch. So we want this to be a point where the patient may feel slight discomfort, but not overall pain. So we can lift and flex until the patient responds to a discomfort sensation. And then we'll hold them here. So if you're going to do the bilateral technique, one hand comes underneath. So my right hand has gone to the left shoulder, and my left hand will go to the right shoulder. So I'm creating a cross underneath, and you hold the person here for 10 to 15 seconds. After 10 to 15 seconds, you'll ask the patient to contract by pushing the back of their head onto your arms with around 50 to 70% of their overall pressure. You do not want full contraction. So what I like to do is I like to ask the patient to gently build up the pressure back to around 50 to 70%. So push back, please. Hold there. Start your counting 5 to 10 seconds from that point. Once you've got to that 5 to 10 seconds, they can breathe in, and as they breathe out, they relax the contraction completely. Take the pressure away, and then you can move to the next stretch and then hold that for 30 seconds. Let the body readjust and get used to that new point. Overall, you can repeat this 2 to 4 times. Just remember to find the first initial stretch, then add the contraction, and hold this last position for about 30 seconds and repeat 2 to 4 times. So that's the bilateral. The unilateral, it's the same process. So you drop the patient's head down. So we moved into a flexion process. Now we can move into a side bending or lateral flexion. So you'll follow the same procedure. You find that first stretch. Patient will report that, support their head, and I'm going to restrict either the shoulder or the head. On this patient, I'm going to restrict the shoulder. So we find that first stretch, 10 to 15 seconds. Ask the patient to push up with about 50 to 70% of their force. Can you do that now? And hold. You count your 5 to 10 seconds as they breathe in and breathe out, nice and relaxed. They let that go, as you can see, and then you can move to the next position where they feel the stretch and hold that for around 30 seconds. And again, repeat 2 to 4 times. So you can see you have a choice of a bilateral or a unilateral technique for PNF on the trapezius.